Hello, I'm Dr. John Sand, a neurologist and an expert in myasthenia gravis. I'm also on the board of the Myasthenia Gravis Association of Kansas City. I have been reviewing some treatments and medications for myasthenia gravis, and I would like now to talk about prednisone and other steroids. Prednisone is the most common of the steroid pills, that is oral steroids that we give for myasthenia gravis. And in fact, prednisone remains really the main treatment for myasthenia gravis. It simply works the best. It is dosed in many different ways. Some physicians choose to start at a low dose and build up slowly. Some physicians choose to be on a high dose for a period of time, maybe 2 to 6 weeks, and then slowly reduce the dosage. And some physicians give it on an every other day basis. Some physicians start at a high dose every day and taper it down to an every other day dosing. Now, steroids help most patients with myasthenia gravis, but it usually takes a little bit of time for it to kick in and start working. Usually at least a couple of weeks, but it may be a month or two. In the meantime, it sometimes makes the myasthenia gravis a little worse in the first week or two. In fact, when I was in training, and it's getting to be a few years ago that I did that, we used to admit patients to be observed for the first week when they started their steroids. We tend not to do that anymore, especially since we've been catching patients who aren't as bad off and starting steroids, and so getting a little worse isn't quite so worrisome. Now, I still use prednisone all the time in patients. It works as well or better than other medications. But most of the time, when you begin prednisone, you're on it for a long period of time, at least months and often years. Prednisone has many potential side effects. Not everyone gets all of them. Some get none of them. But most people get at least some side effects. When you first start prednisone, it tends to give you a little energy. In fact, some people have trouble sleeping during that time. Maybe a little nervous, maybe some mood swings. It tends to increase your appetite and gain weight and maybe retain fluids. Long term, it can additionally thin the skin. It can cause weight gain, elevation of blood pressure and blood sugar, and it can thin the bones a little bit, particularly in women. It can also irritate the stomach and increase the risk of a little bleeding from the lining of the stomach. And this is just a partial list of the side effects of steroids, both short-term and long-term. You need to be very vigilant about anything that is a change in the way you feel when you're on steroids, and make sure your doctor knows right away if there's a change. Some physicians put patients on medications to protect their stomach while they're on steroids. I have not done that routinely unless the patient already has a history of stomach problems. But I always put them on calcium and vitamin D supplementation and have them back fairly often to make sure that we're in touch.